another episode. If my count's correct, we're on episode 4 now.
Right.
Still don't have a name.
Yeah.
That's your fault, actually. We said
Unhinged.
Doctors Unhinged, but you guys in the comment section haven't said anything, so...
Yeah.
We're going with Kalafhi podcast.
No, not to
You know,
mention
for two
that
unhinged people, I don't think that's like a...
the thing is,
doesn't
we can't call it
give-
Kalafhi podcast because sometimes we might say things.
Yeah, there's no disclaimer and
Yeah.
educational purposes
Yes,
and
there
stuff,
might-
but like... Yeah, you know, Doctors Unhinged until otherwise. How
Yeah.
are you?
I'm good, thank you very much.
Look good.
I just came back from Francistown. I went to see my mom.
Yeah. Mumsy from episode 1.
Yeah,
How is
Mumsy
she?
from episode 1. She's doing well.
Yeah.
She said that the first episode was too long, so she was like, I watched
Fair.
it on 2 speed. She's really honest about it. She's like, I watched it on 2 speed and then I'll skip because
To be fair.
she's like, the middle's a bit long, so
Yeah.
I'll skip. So I promised her that we'll try to make them a little bit shorter and more interesting for her.
No, shout out. Always important to check in on the family.
Yeah. What's going on with you? How are you?
As you can see, I am in brighter and more energetic spirits
Sweet
after
one.
taking Dr. Michael's advice about, proactively taking breaks in between work, and as post my very interesting discussion with the psychologist,
Yeah.
also took more advice into just, healthcare. I feel like you never know enough. That's always an approach I've taken in life.
Yeah.
Is, what's that phrase? I'm always with these phrases. Don't just think outside the box. Think as if there is no box. Like, don't limit yourself, man. I feel like always be open-minded to learn things. So I learned a lot, not just from watching, but from being here. So I'm in
sweet.
good spirits, man. I'm in
That
good
is
spirits.
nice. What are your take-homes? Because I don't think I've seen that episode. What are your take-homes? Like, give me 5 take-homes from that episode. Good
You
ones.
see, this is always talking about support local, and my man hasn't.
No,
But to be fair, he's a busy man. So.
Friday, 6 o'clock. Next episode's dropping. We're going to be there.
My take home was that men, believe it or not, are more emotional.
Than women.
Yeah, I see the look on your face. Clearly, you didn't watch the episode.
No, it's not.
I appreciate your honesty. But yeah, men are more emotional. It's just that they don't know how to navigate it, or they haven't been given the platform or taught how to navigate their emotions.
I believe that,
Yeah, because like I had this conversation again. I'm paraphrasing, but it's like, with all due respect, like women can come together and like just talk about what they're feeling, what's going on. When we meet as the gents, it's like, how's the wife? Yeah, no, great. How are the kids? Fantastic.
So good,
How's work? Did you watch the game? How's your car? End the conversation.
And it's superficial.
Yeah, well, not if I like imagine in a male friend group, I'm just like, yo, guys, I woke up today and I just feel like sad. Like, also, I'm thinking in my perspective, like, what am I saying to the next man about that? I'll probably hug you and say,
Sorry about that.
yeah.
Or do you want a drink? Like, I think that's the usual reaction.
No, I mean, yes, but that's not good advice. My advice is, go see a psychologist and chat about it.
Oh, wow.
It's all encouraging, man. Like talk about how you're feeling. Don't keep it in. It's not worth it.
That is actually sweet. I believe that because I've always said that I believe that men love deeper than women because we're more emotional about it. I think women are more materialistic about it. That's a red...
you know how I personally believe I'm a hopeless romantic.
Right.
But how romantic you are is so disgustingly beautiful. Say that again. I'm wowed.
I believe that men love deeper than women do. I think... Because I think men love for the purity of the love. I'm not...
Contrary to popular belief.
Yeah, contrary to popular belief. And I think women love for what can be brought to them. I know everyone's going to be in the comment section saying that's a red pill topic and everything like that.
You know what it is, yeah? I
It's the
genuinely
truth of the
used to
matter.
think I was a cancelable person.
Yes.
Until we started this podcast. Because like it's been 5 minutes in and you said something controversial. And it's not even planned. It's just, I like it because it opens for... open discourse.
Right.
I think before we get into I'm gonna go off script. Before we get into, I'm saying off script like we have a script. I mean, we have a structure, but like half the things you see are just in the moment, as natural as can be. But I want to quickly go on a little tangent about borderline cancelable things, right? And I touched on this about social media and comment sections, but there's like this propensity to like clip things and then take it out of context, right? And I know we had a bit of a back and forth with the whole antibiotic thing.
Right.
And I just want to put it out there, right?
Right.
At no point did I say that doctors are void of this.
Right.
If anything, we're equally to blame, right? I've had my fair share of writing down azithromycin for a supposed flu infection, right? But I think the point I was driving to was we need to work more together as healthcare providers, right? I feel like pharmacists, as great as doctors are, pharmacists tend to be the last stop. And to be fair, the more important point, because you could write all the medication in the world, but as soon as they get to the pharmacy, if pharmacy doesn't dispense, then what?
Yeah, they're the ones dispensing.
You understand? You think you have the power, but it's all in pharmacy's hand. And that's why I kind of started with them in terms of the power they have.
Right.
Now, imagine this, like with your doctors, I could to some degree substantiate why you thought that way. I always give this incredible example, right? I tell you that this morning, a 25-year-old woman came into the clinic. Do you think she's pregnant or do you think it's food poisoning? Granted, the way I structured it, 25-year-old woman, morning vomiting, you think pregnancy, right? But it could be food poisoning. And that's the complexity of medicine. Now, all these, your pharyngitis, the most abused antibiotic, amoxicillin, all of them are listed under pharyngitis, common cold. I'm getting technical, but we went there to examine the patient and get the history. And you and I both know how important history is, because that's where all the answers lie, right? You didn't examine this patient's throat. Maybe the doctor assumed that it might be a superimposed infection. It might be more bacterial than viral. And they can kind of justify why they wrote the antibiotic. Not that I'm saying they're right. They're very wrong. Stop writing antibiotics for flus. Doctors, I'm talking to you now, right? But my thing was, because I witnessed this moment where just right across the room, you had a conversation, did not consult the patient, did not examine them, but decided on which antibiotics to give. I feel like I want to put this clear. We're not pointing the finger at one person.
Right.
My thing
or
was
one sort of like group of people.
Yeah, no, it's not just them. I think
it
was more a challenge to open up discourse, to say, let's talk about these things that are happening. Because there's been many times, and I know the same happens to you, where I'd write on a prescription and I'll explain to the patient, they'll be like, oh, ngaka, the antibiotic. For the why?
Oh, they love that. Yeah.
Why is this happening? So, yeah, absolutely. Let's work together and let's try bridge the gap between these two.
Right.
Now that we're past that, what's the topic for this week?
The topic for this week is PG-18.
Oh gosh.
I think we give a 15-second so that all the kids walk out from the screen. Tell your kids to go and play somewhere. We're going to discuss really delicate sexual stuff sometimes, and there may be words that are thrown around. I want to make a trigger warning, because I don't want people saying, hey, you blurted out a word and my kid was watching it, and that's not nice, right? So I'm giving everybody a chance to PG-18, all right?
It's episode 4.
Yeah, episode 4. So it's going to be mostly on sexual health, and we're going to do sexual health and also antibiotics, which, because it's been a big one given the week that we've had.
You know what it is? I'm glad we're doing that one, because it's almost, I'm going to take a stretch, but it's almost taboo to talk about it.
Yeah.
Mom, Dad, I really love you guys, but I would like to go on a limb and say a lot of African settings, like African parent settings, I don't remember a time when my parents sat me down and said, this is what sex is, don't do this, don't do that. Yeah. Pretty much learned most of it in school.
Right.
I don't know about you.
Was that in a class in school, or was that from
biology? I think we had like sex ed or sex health at some point.
Right.
But majority of the time, it's more like friendship groups where this is going on, right? So it's a good thing that we can have open discourse from a health standpoint about it. Agreed. Did your parents talk to you about sex?
Yes. Growing up, I had I had an uncle, actually. Shout out to Mr. Rahman. He's a big man. But yeah, he sat me down when I turned 14, and he brought like condoms and things, and he gave me the talk.
Really?
Yeah. He was like, use these, especially for the girls that are not so pretty. So he said that. No, it's not me, it's him. All right, because everybody's going to be like, yo, why would you say that? No, but he said, because he was like, if you're doing it and then the girl gets pregnant, you're risking a lot, especially if she's not like your type. Do you know what I mean? So yeah, he gave me the sex talk. And I thank God that I had somebody like that to talk to me about it. But I also had that at school as well. We had guidance, and in our guidance lessons, we had a lot of teachers that were able to guide us in that particular regard.
I just think we need to make it more of a norm.
Yeah.
Aside from that, stuff like finance as well should be a norm. I feel like it's almost taboo to talk about it. But like sex is that big topic. And the reason I'm saying that is, I think I mentioned this in episode 1, where even patients are like kind of shy to talk about it. I'm like, it's okay. Like if you're gonna tell me about your headache, tell me about your sexual life. Like remotely, I see give or take maybe 30, 40 people a day. I'm gonna single you out and choose to have a conversation about like
I'm doing it.
First of all, I'm bound by oath not to be discussing your business outside. Also, I probably may not fully recall what it was that's going on. I just want to help you. So like don't lie to your doctors. Yeah. Be honest. You said this, right? I think I was posting on your WhatsApp.
I just say don't be shy, man. The two people that you should be lying to is your lawyer and your doctor.
Real.
Those are the people that you want to tell the full truth. So today's topic is guided by the comments and the people that came to our inboxes. Remember, mine is at _Michael Nyoni and Dr. Nello is
at ovo.afittingroomina.shop.
Right. I'm sure the producers will have it right down here. All right. Do the right thing, guys. Don't embarrass me, because like people are going to be watching this thing and be like, where's down here, mate? So do the right thing and put it there. Do shoot your questions. If you want a shout out, you can write it in the comment section. We will give a few people shout outs today because they asked questions in the comment section of the YouTube channel. But if you want your question on a more private thing, just send it on Instagram. We're ready to receive those. So we'll start them up. The first question, I'll give this to you, Dr. Nello, is what happens when I don't finish my antibiotic course? What happens when I don't finish my antibiotic course?
You know what it is,
yeah?
Because I had one man chat to me about, because me, I'm inquisitive, right? And like I proper like things, and it helps with the practice because, I'm coming back to that. I just remember because it just hit me now. You know when you open up a clinic of your place, right? You call it, I'm opening up my own practice.
Right.
You practice medicine. It's not a fine art. Like you don't fully learn it. It's a daily learning process.
Right.
Touching back to what I was talking about with like pharmacy and stuff, we keep learning every day. Now, I always just ask, like, okay, what's going on? When did it start? Have you been taking anything for it? And he's like, yeah, I've been taking antibiotics. I'm like, from where? He's like, I got some from my cousin. I'm like, first of all, your cousin didn't finish his course.
No, we had this. I think it's the last episode as well.
I don't even remember.
Something like that. Yeah.
But like, he didn't finish his course, and then you just started prescribing for yourself as well. Well, you're running up the risk of what we're trying to combat right now is AMR, antimicrobial resistance. Essentially, what happens is, imagine you have like 10 bacterial bugs, like on a very fundamental level, right? You have 10 bugs. Now you take your antibiotics, let's say for 10 days. Each day kills off one bug. Okay. Now, if you decide to stop at day 7, there's 3 bugs that didn't die off. And these 3 guys kind of got like some exposure to the thing that was there before. So they become super bugs. Next time you try to use the same thing, they already kind of know
they have a resistance.
What's coming. And that's where the resistance, I mean, like at a very simple level, that's where resistance comes from. So you're running the risk of increasing the issue with resistance, right? Also, if you pass that on to the next person, it's not just about you. Like it's a communal thing, right? You're running the risk of spreading the super bug. And if there's no antibiotics to help it, then Lord have mercy.
That's you're propagating.
So please finish. Just finish your antibiotic course. I think anytime that you consult with your doctor, and in the event they don't tell you they've put you on antibiotics, which they should, ask them, am I on any antibiotics? Any of these meds, do I need to finish them, or can I stop if I feel better? Because again, I can't really blame the patients, because most of them, as soon as they feel better, then you gave me Panado for 5 days. On day 2, my headache stops. Why am I taking the Panado? Right. It's a logical way to end to it, but my thing is,
symptoms end at some point, right? So your symptoms could start. They could get better by day 3 and day 4, and then you're like, I feel better. Let me stop taking it. Exactly. And that's not the way they're supposed to work.
Just finish it out.
Because of that great analogy of like, okay, 10 bugs minus 7. If you stop now, you're kind of ruining the whole thing. So do better. Do better.
Finish.
All right. The next question is about alcohol and antibiotics. Everybody's told not to drink when they're taking antibiotics. Funny story. festive season, this couple comes through to the clinic and they're like, obviously I'm not going to drop names because that's illegal.
We never do that. That's against the
but
law.
But couple comes in and they need antibiotics to treat a certain infection, right? I give them antibiotics both and I'm like, yo, I know it's festive season. It's like 27th of
It's always a disclaimer.
December. I'm like, I know it's festive season.
Always a disclaimer that time.
But once you start taking these, you cannot continue drinking, right? I know you've been drinking because they came and they were like proper lit. So I was like, what's going to happen is as soon as you start drinking, you're going to vomit, you'll have a bit of nausea, you'll have these palpitations, and you'll have like a proper flashed face. I told them straight like that. And there's only 2 antibiotics that will cause something like that. It's metronidazole and tinidazole as well, right?
Yeah. Psychosis.
Exactly. So these guys come in 3 days later. This woman is
they
panting.
Didn't listen.
Bro, she's panting.
I'm surprised though.
She's panting. She's like, Doc, I don't know what's happening to my heart. I was like... So at first I didn't recognize them, right? I opened the file, I read, I was like, wait a minute. I saw you 3 days ago. And I was like, yeah, you saw us and then you gave us medication, but I don't know what's happening to me right now. I was like, I literally warned you that if you do this, you're going to have these palpitations.
You know what, I know it's a new month now, but like touching on like mental health and like being kind to your doctors, I was on about that. Yeah. You know those I told you so moments, right?
You're right.
Because you have to be professional. You can't be the guy that's like, but I told you not to do this. You're still, regardless, you're always going to help.
Still have
and
to
like,
help,
we always do it with like a smiling face regardless. It's like, okay, to be fair, I get it. But like, geez, man, 3 days later.
So yeah, there's that. But generally, and this is a good disclaimer, with most antibiotics, it's ask your doctor. Do you know what I mean? My patients know if there's one that they're not supposed to drink with, I will tell them. But with most antibiotics, there's a lot that there's leeway there. Given drinking can exacerbate the side effects of an antibiotic, so you could get more dizziness, you get more vomiting, more stomach cramps, and things like that. But also, it can weaken your immune system. So I know for a fact with respiratory infections, if you continue to drink alcohol, contrary to popular belief, lowers your body temperature, and then that helps to propagate the infection.
There's a contrary belief that it increases it.
Do you know people think that in Russia, we used to take shots before we get into the bus because apparently it's cold. And no, that's a stupid thing to do, and we're not idiots. So no, we didn't do that. Nobody gets warm from drinking, so don't do that as well, okay? Despite what you feel.
I just lost my train of thought. There's something I wanted to say. I got stunned by the fact that that's actually a contrary.
That's the thing, yeah.
Belief. But more than anything, what you just said about the immune system, right? Alcohol is a depressant.
Right.
Unlike cocaine, that's a stimulant. Don't do cocaine. Don't look at me and think, oh no, doc said alcohol is bad for you because it depresses you. Do not do cocaine. I don't even know where you're getting that stuff
drugs
from.
Drugs are bad.
Yeah, it's horrible. Okay. You know this again. Like, don't even listen to me. Just listen to what you've seen. Listen to what you've seen. But yeah, listen to what you've seen. You know that when people get drunk, they get slow, right? Your speech gets slurred, your mobility and vision gets impaired. You're just like slurry and all over the place. Same thing's happening to your immune system. Not only that, but you're slowing down the effectivity or the efficacy of the antibiotics.
Yes, because some do get digested through your liver as well. And if you're hindering that process...
Yeah, because your liver is busy digesting all that tequila that you've been drinking, what's going to happen? So my thing is, as Dr. Michael said about ask your doctor, right? We're being honest here. There's some sort of leeway, but do not want to run the risk of drinking on your antibiotics, because I don't want you to be the person that comes in and tell me, oh, no, I took penicillin last time and I was drinking Savannas every single day and I turned out okay.
Fine. Yeah.
Don't do it. Like, if you're going to be on antibiotics, just please finish the course, get better, and then go back to whatever it is that you want to do. So don't do it. Don't do it.
As a follow-up question as well, there was something about how long should I wait after my course to stop, to have my next glass of wine, which is, okay, I think 24 to 72 hours.
I was about to say like 24.
Oh, okay. I thought you were going to say next day.
I mean...
Take it down with the...
No, I would say give it a... For some reason, the body likes threes, 3 months, 72 hours. I would say 24 to 72. On the safe side, take it to be 72. Open to correction, but I'd say wait it out 72 hours.
That's a good one. I think, that's a good one. Next question. was going to try and remember it. Smoking. So we had a guest that asked, does smoking, cigarettes and vape, does this affect men's erections and fertility? Yes, it does. Both cigarettes and vapes, because they do contain most of the same properties, but mostly cigarettes because we've had cigarettes for much longer time, and we've had a lot of studies that have showed that it affects your blood vessels, and you need your blood vessels for the blood to flow down to your penis so you get an erection.
They're vasoconstrictive, right? Cigarettes.
Yeah, exactly.
So they make your vessels thinner, so less blood flow comes in.
Less blood flow plus the cholesterol as well. So then you have your thin blood vessel that's already clogged, that can't get blood to there, and then you wonder why you can't get it up, when in fact you should just stop smoking. So stop smoking. I am not an advocate of smoking. I despise it very much. I tell all my clients who smoke to stop smoking because that is about the worst thing that you can do to your health. So please stop smoking. Get help. If you need help, do come to me. I have a lot of anti-smoking regimes, both vape and cigarettes, by the way. Oh, come on. Today I'm trying, Doug. I'm really trying. I'm holding it back, man. And then another question was, and I'll give this one to you, is that what about women's fertility? Does this affect women's fertility as well?
Listen, let me just put it this way, right? Without getting into like the technicalities of the science behind it, anything that has a label on it that says it's harmful for your health, don't be doing it.
It probably is.
Yeah, just don't do it. Because you have to understand this. Let's break it down from a point of, let's look at water and food. Right. These are technically needs. Right. An iPhone is not a need, it's a want. So if that, no, it's a want. If she's pressuring you to buy you an iPhone, don't do it. She will live without it. My thing is, like, your body needs water, that's why you feel thirsty. Right. Your body needs food, that's why you feel hungry. I know a lot of people, that live probably fine without ever smoking a cigarette.
Right.
So my thing, if it's like, and on the labels, my brother, it literally says like drinking is harmful for health, smoking is harmful for health. Why do you want to risk it? Like, it's like me saying to you, because I proper love, let's like giving analogies. Standing in the middle of the road on a highway is bad for you. Must you go stand on the highway and then get hit by a bunch of cars to figure it out? No.
To find out.
Just don't do it.
Right.
Don't. And to answer the question, yes, it is bad for you.
There you go. So those are all the alcohol-related antibiotic questions. There's questions about PrEP as well. Because there was a statistic. Did you have that statistic with
how many people are on it?
Yeah, how many people are on it?
Is it 1,600 or
19,000, mate.
1,000?
I promise you. Let me check that out. Let me look for it. It was on the newspaper, isn't it? Wait, I got it. Yes,
I have issues with this.
16,362 people are on PrEP in Gaborone.
Just in the capital
in
alone.
Davs, people are on PrEP. First of all, I want to say shout out, because the question here actually, so the person who asked this question said, why are people taking PrEP like sweets?
It's candy.
Yeah. Well, okay, so
such a
PrEP
debatable
is
one.
Pre-exposure prophylaxis.
Yeah.
Right? It's a treatment that you give to people that are likely to go and get exposed to HIV.
Yeah.
Right? So you give it before they get in contact with the person that might have HIV.
Compared to PEP, by the way?
Compared to PEP that we give to somebody who has already been exposed to somebody who already has
post-exposure.
HIV. So it's post-exposure, right? It's effective. 99%, right?
Reducing HIV transmission.
Yeah, it's reducing transmission. So this is a drug that we're giving to sex workers, to people who have multiple sexual partners, and to people who are engaging in a lot of other risky behaviors like taking intravenous drugs.
It reduces like by 74%.
Yeah, right. In those.
Also, don't be injecting drugs. Don't do drugs.
Drugs generally, yeah, we don't recommend.
Where in Southern Africa are you injecting drugs?
Joburg, but yeah,
okay.
Don't do drugs generally. Yeah. So that's what PrEP is for, and that's why people are taking it like sweets, because we have a high.
The rate in.
Yeah, we've got a high HIV rate here in Botswana.
Staggering.
Yeah. So because of that, I think people are encouraged to take PrEP. So if you know that you are using drugs, or you've got a partner, or at least one of your partners is HIV positive, and if you have multiple sexual partners, it is worth taking PrEP. Side effects include nausea, vomiting, and stomach cramps. Rarely you can get some kidney function problem or liver function problems.
If monitored.
Yeah, but that's why we monitor them. So before you go and get the injection at Develop Bailey, they'll tell you to bring liver function tests.
My man plugging the location as well.
Yeah. Go and get that injection. If you know that you're in risky things, go in and,
But knowing the city...
Okay, so here's a little encouragement if you're not down to go and take it. If you and your partner are having unprotected sex,
I know like where this is going, but go on.
The chances of them cheating on you and having unprotected sex are at around 90%, let's say. And this is a statistic from my head. But somebody who's not using condoms with you is unlikely to not use condoms when they meet the next person. I'm telling you this now. If you're out there in the streets, protect yourself, okay? And get that injection.
I have a question then as a follow-up, right?
Go on then.
Granted that first time I heard of PrEP, interning, it was primarily introduced for sex workers, right? Euphemistically speaking, but because they're at higher risk and because they're doing this on a more frequent level, right? So my supervisor, because I asked him, I'm like, okay, is it just exclusively limited to them? And he's like, well, if you're sexual like once every month, probably don't, right? I'm like, okay, then what are the side effects? Because you're better safe than sorry, right? Yeah. It's almost like wearing a mask during flu season. Like, should everybody wear a mask during flu season? Is it actually beneficial or not, right? And well, all the data is pointing to the fact that, okay, it's not really hitting your kidneys.
Right.
In rare occasions, especially if it's monitored well. The benefits, considering where we are, if like the statistics of HIV and AIDS were like 1 in 100. I mean, I think now it's maybe 3 in 5 or 4 in 5. It's relatively high. Like, we know this. Would you then say, I'm going to put you on the spot. Would you then just recommend everybody to be on PrEP to kind of limit the spread of it at the rate that we're going?
Yes.
Yes.
I would make it like a COVID vaccine. You can't.
Everybody gets PrEP.
Yeah, you're not getting to pick and pay without PrEP. give me your PrEP. Give me your PrEP certificate. No, because if it's that bad, then it's an endemic.
It's a
right?
viable
Yeah,
solution,
if it's that bad, then we
I would wager on it. I think it could work.
Yeah,
it could. It's worth a chance given risk versus reward.
Exactly. Yeah,
you're not getting to pick and pay is wild.
No, it's a real thing. I think that's how we would look at it. I'm not saying we're there right now, but I'm just saying if we did get there, it would be worth considering it as one of those like COVID.
I heard the injectable is now available, like you mentioned, Develop Bailey.
Yes, the injectable is now available. I think it's once every 2 months. It is free. All you need to do is liver function tests, and you can come through to us for that. We'll be happy to do it for you. So we'll do those liver function tests for you, then we send you all the way. No, you need to be negative for the test. So, yeah, there's that. Hey.
Also, quick 2 points.
Yeah.
While we wrap that part up.
Right.
I think if this was back in the 70s, 80s, HIV is like a big deal.
Right.
And when I have moments where I have to break the news down to a patient, I always try put it down to the fact that, like, with the progression in medicine, you literally have to take like 1 pill a day.
Yeah.
And you could lead a normal life. Yeah. There's no immunosuppression. You wouldn't be able to transmit this on to the next person. It kind of nags me. There's still a stigma around it. Maybe because, you have the medical knowledge prior to it.
Right.
But I always feel like, consider it like high blood pressure or diabetes. Like, this person's taking a pill every day to keep their BPs normal. You're taking this 1 pill a day to kind of keep things in check. I think with how long it's been around, at some point we have to have the conversation to say it's a part of us. Let's stop like the mini discriminations around it. And I'm driving to a point here, right?
All right, go on then, because I have a hot take, by the way. Go on.
My thing is signing up for PrEP or advocating for it, for lack of a better term. Again, have this conversation with your doctor. Don't just listen to us. Do your research, okay? I'm always encouraging people, like, get a second opinion, do your research. Say, listen, I watched this podcast, and these two unhinged guys, brothers were talking
about inject them.
Yeah, get PrEP. It's good for you. Like, look it up, right? My thing is, no one's giving you a green card to be promiscuous and have multiple partners because, I have PrEP.
Which, by the way, is a life choice. I mean, we're not judging you as well if you're doing it. I just want to put that out there. Feel free.
There's many other things that could happen.
Right.
There's many other sexually transmitted illnesses that your PrEP is not covering for.
Exactly.
There's, for lack of a better term, unplanned for pregnancies. By unplanned, I mean, imagine one brother, and I'll use the brothers, okay? Imagine one brother, and the reason I'm using brothers is not a discriminatory thing. I'll explain why I'm not using the women. Imagine one brother knows he's on PrEP, so he's good, right? And in a week, sleeps with like 20 women. There's 20 women pregnant, right?
If it's
versus, it's very tough. Versus a woman that, for lack of a better term, you could only get pregnant by one person for 9 months, right?
Yeah.
So with women, it doesn't kind of like necessarily weigh. But as the man, you're the problem because you could have like multiple pregnancies at once under the guise that, don't worry, sweetheart. Nah, I took PrEP. Here's my certificate. Don't worry, I'm good. It's not just PrEP. I mean,
it's not just HIV.
HIV that we're worried about. Like there's so many other STIs. Yeah. There's pregnancy as a whole. Don't be bringing kids into the world if you know you don't even gonna remember the time that this child was conceived and you can't be there for them. So be responsible, man. Sometimes I get it and I understand and I hate the fact that the science backs it up, right? But I feel like we live in a society where it just might give people the green light to be promiscuous.
Oh, yeah, with PrEP. It definitely could. Also, again, about
the hot take. What's your hot take?
20 kids. I believe that we have a population decline in the world right now and people should be doing as much as they can to have children. So do your bit, all right? Do your bit, okay? I know Dr. Nello said don't have 20 kids, but listen, if you can afford it, you should do it.
Have you seen the state of the economy, mate?
No. There's people that can afford having many children, and you people should go ahead and have many children. The population is declining, right? We're having less and less kids, and I want people
especially
to
in Botswana.
Exactly, and Botswana is a small population, so let's do the right thing, guys. Go on and the president promised you guys 300 pula. Come on. The president said 300 pula if you're having kids, so let's do the right thing then and get busy. Shout out to the president, by the way, his favorite guy. Okay, next thing.
Oh, Lord.
There's a debate that's been going on Facebook because we're about to clap the podcast now.
But it is.
We've got a few more minutes.
You say these things with a straight face.
No, because it's the truth. It's the truth, mate. So the next thing is on Facebook, there was a big debate the other day, and people were arguing, should a person with HIV disclose it before sex if they're on their medication and they're doing well?
Yeah, why not? And I again, you see what I was talking about, the whole stigma thing.
Yeah.
Like, this should be a normal conversation, mate.
Like, yeah, look, I've got HIV, but let's go on.
I'm paraphrasing, but I know there was a trial in the 70s, 80s, 90s, I don't remember where, but this woman took a man to trial for attempted murder.
Yeah.
Based off the fact, I mean, back in the 70s, like, the medication wasn't really available.
Also, he didn't say.
Yeah, he knew that he was positive, but he didn't disclose this to her, and then infected her, and then she went to trial and charged him for attempted murder, right?
It's rape.
Yeah, sure. Contextually, sure, we could put it that way.
There's a word for it as well. It's called obtaining without
Consent.
full disclosure. Not even consent,
Valid.
but yeah, exactly. Obtaining
you
without
could classify it under.
So it is a rape. Yeah, it's a rape.
A
case.
variation of it.
Lawyers correct me on this, right? Is that a rape case?
Yeah, let's get the lawyers involved
or not. Yeah.
So my thing is, why not just say it? Like, if they don't agree, then at least you give them the option. Because my thing is what could happen flip side is when they imagine, like, you and this person come together and you're like, oh no, I'm good. I did my test, A, B, C, D. And then in the next day, she's looking through your closet and she finds your ARVs and it's like, but this has your name on it. And this was dispensed 3 weeks ago. What's going on?
But you just said if you're taking one pill a day, then you're good.
I mean, if you've been on
your ARVs.
Yeah, so have that conversation. If it's an issue, go see Dr. Michael, go see Dr. Nelson, go have a conversation with your doctor to explain that, listen, this person's been on medication for this and this long. Their viral load is suppressed. They can't pass it on. I have learned this the hard way. Honesty is the best policy. And you've been told me about this as well. Just say it as it is.
Yeah.
So, I mean, the debate can have equal opposing matters. But I would say at the end of the day, why not just say it? It seems less of a problem to me than hiding it.
Yeah, be honest. You want to start a relationship, and this is just on a matter of integrity. Just say it. And I'm not saying it, just say it.
I'd respect you more.
Exactly. Yeah, I think I would also respect you more. And also on the flip side, for the guys that are not like there, right, then you guys just don't make a big deal out of it. If a person confesses that, look, I'm positive, and they're on medication, then they're all good, man.
We're human beings. Life happens. I mean,
life does that. And some people didn't even get it by choice, man. It's not like she was in the streets. You could have been born with it. So don't be that guy.
Be kinder, man. Yeah. Touching back on mental health. And speaking of that, I don't know if you have anything else, but I'd like to introduce a new segment.
Right. Yeah. We need to do that. Exactly. We need to do the health nugget, is it?
Yeah.
Right. Go on.
I think right now you'll do the health tip. I'll do the health myth.
Okay, cool.
So debunk something and give advice and conclusion. You want to go first?
All right, cool. I'll go first then. My health nugget of today is summer bodies are made in winter, so go out there and exercise. And when I say exercise, I mean go there, do something really active for about 30 to 40 minutes for about 4 to 5 times a week. You want to do that, and that's only 10% of the work that you have to do. The other 50 to 70% comes from you doing active things during the day. So that's you choosing to take the stairs or not the lift at work. That's you choosing to walk around instead of asking your receptionist to bring the papers to you. It's all the little things that you're doing that help you to lose that weight. So let's lose that weight, guys. Let's have those beautiful bodies out there in summer. We'll be flexing at the beach. Let's do that all together. And that's the health tip of the day. Exercise, but also stay active.
Yeah, no, it actually does help with like mental health, which helps. I mean, so the physical health will eventually help with the mental health. Yeah. 100%. Also, disclaimer, I was out of the gym for 3 months.
Yeah.
I just got back a week ago.
And tell them you were paying for it as well.
I was. And I won't lie, get you a person like Mikey, because he was like every week he's like, Chibaba, let's go. Chibaba, I'm like, hey man, I'm so tired, I can't go. Let's go. As you can see, Dr. Michael is relatively fit.
Oh, you're making me shy.
Yeah, it's the truth though, man. I mean, like, so he knows what he's talking about. Listen to him about that. All right, so get active, be proactive about your health. My myth buster of the week is that, let me see if I can. I did.
Okay. I think that
cracking your knuckles doesn't give you arthritis.
Oh, shout out.
Yeah, it doesn't give you arthritis. It's annoying, and it's going to irritate the people around you, but it's not going to give you arthritis.
There we go.
What's his name? Donald Unger, or Dr. Donald Unger. He cracked his left wrist for 60 years, and the right one, he didn't. And they checked at the end of 60 years, and they realized there was no arthritis.
Right.
That's investment,
That's an investment.
He won an IG Nobel Prize. It's not an actual Nobel.
What's an IG Nobel Prize? Like from Instagram?
It's like a trivial one for like borderline useless research.
Mate, honestly,
this is like a simplified way.
That's a stupid thing to do as well, and nobody can prove that.
Yeah, it's like trivial research.
My man was probably cracking those fingers in the background as well.
So he cracked. It's just gas bubbles popping. So you're not going to get arthritis from it.
Okay, good.
Because again, these things may seem like laughable, but like there's someone out there who is cracking their fingers every day, and the next person's like, don't do that, you're gonna get arthritis. So tell them that we told you that you're not gonna get it. There's a guy called Dr. Donald Unger. I don't know where he's from, but I think in 2009 he won an IG Nobel Prize for cracking his fingers.
Nice, sweet.
So crack your fingers and be healthy.
Is it crack your fingers, do your style?
Hey,
you can do it all by yourself. All right, guys, this is it for today's podcast. It's a bit of a long one, I won't lie, but I hope that we answered everybody's questions. We tried to dive deep into almost every question that we got, and we appreciate all of that. Also, shout out to Tsero. I almost forgot to shout out to Tsero. Tsero left a beautiful comment, and Tsero is such a sweet patient because she's always concerned about us when she comes into the... Yes, she came. Yeah, she's always like, yo, are you okay, doctor? You're right. And even in her comment...
touching story, bro.
Yeah, she was like, are you okay? Yeah. She's like, are you okay? I am okay, Tsero. Shout out to you, and thank you for being a loyal subscriber and watcher. There's also Katso Ramudia, right? That's also a very loyal person who's always commenting. So shout out to you too. Thank you. You're a lovely, lovely, lovely person for supporting us. Please continue to watch, like, subscribe, click the notification bell so that, I never imagined that. I never say that in my life, I never thought I'd say that. But yeah, do that. And yeah, we'll see you guys on the next episode.
Yeah, have a good week. Drink water, be kind, and mind your business.
Sweet one.